All right, everybody. good morning, and welcome to Florida Training Academy. So, you all are here for the CPR/BLS instructor course. My name is Eunice Mathis. I've been a nurse for 23 years. What I'm going to teach you is we just want to do a skills review before we even start the actual course, because that seems to be a knowledge deficit for a lot of instructors, especially if they're new or if they've not been in a hospital environment where they work as a team. And so with the CPR/BLS, just don't think of healthcare providers. Think of anyone who would work together as a unified front, rapid response. Sometimes, whenever I'm teaching those who work in the marine industry, if there's an emergency out there on the ship, the Coast Guard may not get there for 30 minutes. They have to manage that emergency. And so that's what we're going to teach you. We're going to teach you individual CPR, but also how to work as a team. And we'll talk about the differences in the terms that I'm using, but it's important for you to understand those terms as future or current instructors, because when your students call and they ask for a CPR course, they don't know what they don't know. And what they don't know is if they just get a CPR card, but they're going to nursing school, that the school will not accept the card that they have. So we have a term called basic life support, and we have a term called CPR. What does CPR stand for, anyone? Awesome. Cardio, we're doing those chest compressions. Pulmonary, we're going to be providing rescue breaths. However, due to COVID, even prior to COVID, you didn't have to put your mouth on the victim's mouth, because back then we were worried about, contracting herpes or they may vomit. But now with COVID, there's not a facial device at this current time that's going to prevent COVID from crossing. And so you can do hands only, sustain life, circulate blood to the heart, the lungs, and the brain. You can do hands only compressions until your team arrives. And when your team arrives, they're going to use the bag mask device. When you call 911, call EMS, they're not going to come there with a pocket mask and a facial shield to give a breath, because that's not going to protect them from contracting or passing COVID. So, anyway, you can do hands only CPR to help save a life. That's if you're teaching basic CPR. Basic CPR, you can incorporate breaths, but if not, you can wait for the EMS, for those professional rescuers to arrive. When you think of basic life support, I want you to think of when you watch a TV show like ER, and all those people around the bed and they're fussing, and this doctor knows more than that doctor, but we're supposed to actually communicate better than that, and they're doing all that for drama. Okay, so, and she's smiling. And so you want to be able to work as a team. What are some of the team roles, do you think? If you had the five of us and we were your team members and there was someone in cardiac arrest, what do you think some of our, if you had to delegate task, what task would you delegate? You go get the AED device. Okay, the AED, awesome. What else? Automate chest compressions. Perfect. And if we had equipment to ventilate, you want to delegate someone to manage what task? The airway. And so I'm just going to repeat that. So she said the AED, or the electrical activity, and then we have our compressors, we have someone maintaining the airway. But when we start watching the basic life support videos, they're actually going to have a team of rescuers come. And some of those are advanced rescuers, such as doctors and nurses and respiratory therapists. So if you have additional team members, someone can start the IV, give medication, start the IV fluids, but it's going to be really important for you to know your role. And if you're not a doctor, a nurse, or a pharmacist, you can't give medications. You more than likely cannot start that IV. And some of us have on masks right now. Imagine full COVID season with us having on full PPE, and the doctor points to you and says, "Hey, you, I need you to intubate." You look like you can intubate. Can you intubate? Is that within your scope of practice? No. You want to let that doctor know that, hey, doc, I can't do XYZ, but this is what I can do based upon my certification or skill. You don't get to leave, because you are part of the team and you can do those chest compressions and you know how to work the defibrillator. So during our class today, we talked about CPR being cardiopulmonary resuscitation. When we get to pulmonary, at no point will you put your mouth on our equipment. We will only simulate breaths. When you teach your classes, it's what works best for your environment. If you know you're around a team that always works together, and if Mr. Johnson goes down, you're going to give Mr. Johnson mouth to mouth, well, then you may want to incorporate that in your classes. But when you watch the video discusses mouth to mouth, but we don't actually practice it. They will instead have you practice pocket masks, and we'll show you how to use that device also. So, CPR, do you have to provide rescue breaths? No. When in doubt, speak to your risk managers at your companies to see what's going to be the requirement. And when I go out and teach corporate classes, a lot of those risk managers are like, no, we're going to do hands only CPR. We're going to use the AED. And when the emergency responders come, that is when they can use that bag mask device to give a breath. If you're in the hospital, then of course you already have that bag mask device there and it's on your crash card. What does the AED stand for, Andrea?
Automatic external defibrillation.
What does that device, what does it do to the heart's rhythm?
It sends an electrical signal through it to try to restart that from a arrhythmia. Try to stop it, start it, and put it into a normal rhythm.
Perfect. So to help you all pass the test, which we have today, we have two tests. The AED normalizes an abnormal heart rhythm. That's the goal. So you want the AED to get there as fast as possible. All right, so we talked about chest compressions, we talked about breaths, we talked about the AED. Do you know how fast we compress? How many compressions per minute?
100.
That's minimum. And what's the max? Help her out, team.
120.
120. All right, 100 to 120. And it's okay, we'll write notes again in a few moments. How deeply do you compress for an adult?
2 to 2.4.
2 to 2.4. You all today, you're taking care of a bariatric patient. The side view of their chest is this wide. Going 2 inches may not be as effective. So give me that fraction.
1/3.
1/3. You bring the side view of that chest in a third of the way. Is it a possibility that we're going to crack ribs? Absolutely. It could happen. What law protects you if you're rendering aid? It's a biblical story. Good Samaritan law. And so, as a CPR instructor, I really encourage you, if you're going to be teaching in different states, but you want to know the Good Samaritan law for that area. And so, if you're taught basic life support, you're a basic life support instructor, and if you're teaching based upon those standards, the Good Samaritan law should protect you. However, if you decide to go in and create a little hole in someone's throat and make a tracheostomy, then of course it's not going to protect you. So as long as you're doing what you've been taught, you should be okay. Why are women more likely to die from sudden cardiac arrest? You know? You can't think of it. What about you, Andrea?
I would imagine that less people are likely to, like men,
Mm-hmm.
want to go out there and are afraid of being
Bring it out. You're on the right track.
breaking, being sued for.
You're absolutely correct.
They have breasts they don't like to do.
So if a woman were to suffer from sudden cardiac arrest, she is more likely, and this is outside of a hospital, she's more likely to be resuscitated if she's around men because of the breast factor. Yes. So it could be because they don't want to touch us because they think they're going to have a sexual assault case. But if you are a professional rescuer, you can still perform chest compressions on top of clothing. But why is it vital that you disrobe for the AED? So there may be a delay in someone starting CPR because they don't want to touch your breast. And then even once they touch your breast and they're calling 911 and 911 takes 5 minutes to get there, by the time someone finally cuts your clothing off and exposes your chest, it's been about 4 minutes before anyone ever used the AED on you. So women who sustain sudden cardiac arrest, I think their survival rate is 38% versus 43% if it's a male. And so when you're out there and you're teaching people, I need you to make sure you let them know about those statistics. And that if a male exposes a woman's chest, and she is in cardiac arrest and he knows CPR, he's supposed to do that. And he's protected by the Good Samaritan law. And if he still says no, because I teach a lot of people and they say, no, I'm not doing it. If they still say no, encourage them to provide CPR on top of clothing. And when a rescuer comes who feels comfortable taking off and exposing the breast, that is when we'll do that. All right. And so, what questions do you all have before we start our practice? What does ROSC stand for? And so if that term is foreign to you, imagine a 17-year-old go-getter who's like, look, I'm about to be a CNA. I just want to get my BLS course so I can be a transporter in the hospital. And you start speaking terms like ROSC. I need you to take those medical terms and simplify them. We have to use the medical terms because the American Heart Association videos say those terms, but in layperson terms, the pulse returns. The person's alive. ROSC is return of spontaneous circulation. How long can you take your hands off of the chest? 10 seconds. And this is a little bit tricky for people to comprehend. The old school way, if someone was in cardiac arrest, we say ABC, ABC, ABC. What does ABC stand for? Yes, airway, breathing, circulation. And so when there's an emergency, we normally focus on airway, but cardiac arrest is a different emergency that requires a different response. Once someone no longer has a pulse, we're not focusing on their airway. Our new priority is CAB. What does CAB stand for? Just change those letters around. Yes. And so that's why you don't have to give a breath right now. So you can do hands-only CPR to circulate that blood. There's still some residual oxygen in the bloodstream. Your job is to circulate it. We're trying to preserve the brain, send blood to the brain. And whenever your team comes, that's when they can focus on the B and the C, the breathing. Sorry, the A and the B, the airway and the breathing. I said all that to ask the same question that I ask every class. If a victim in sudden cardiac arrest vomits and you're by yourself, what do? Chest compressions. If you turn them to their side to clear out their airway, what is happening to the blood flowing to their brain? It stops. Okay, so if you're by yourself, you will not turn your victim to their side to clear out their airway. You will have to keep doing your high quality chest compressions. You can try to sweep their mouth out within 10 seconds, but you get back on that chest and keep doing your compressions. And when your team comes, they have suction equipment, they can intubate, they can bag, but that is not your primary focus if you're a solo rescuer. Okay. You two are going to be teamed together. You two are going to be teamed together. So when I get you, when you stand, would you please come over here? All right. And when you stand, if you can come here. Andrea, when you stand, you all can stand now. Would you come here? And then Shilling down, when you stand, if you'll come here. All right. So you're going to be at the head of the victim. I'll give you a bag, and you're going to be on this side over here. Okay. All right. And so I may have to turn this around just a little bit. Can I get you to stand right here? All right. Let me get you right here, Andrea. Okay. All right, because what I'm worried about is whenever you are practicing, and you have to know like the layout of your room and the layout of your equipment. When I purchased these tables, the more sturdier part is on the opposite side. So I kind of had you all stand the wrong way. I'll fix that in a few moments. So if you're purchasing equipment, you want to try to purchase equipment that maybe has four legs on the table. The reason why we use the tables is because we're used to training healthcare professionals where if there was an emergency, we'd normally be on the elevated surface, such as a bed. Okay, our beds go into CPR mode. Our patients would not necessarily be on the floor. However, if you're training people, depending on what audience you're training, some of your students have to go to the floor. Some of them can be on the elevated surface. Regardless, if we do have our patient, our simulated patient on elevated surface, and our compressor cannot compress deeply enough to get those feedback devices to actually indicate, we're going to put that person to the floor. Right, so it'll make sense in a moment. So if I can get you to please locate, we're going to talk about the xiphoid process. It's at the very end of the breastbone. Do not compress on that. We talked about the fact that you could possibly break bones. That's not one that you want to break or lacerate because the liver sits beneath it and you could puncture the liver, right? So pretend the person has a perfect breast line or nipple line. Interlock your hands like so and press your hands right in the center. So I'm gonna shift you. Your hip should be aligned. Oh, you're moving too much. There we go. All right. And you may have to tippy toe. Press straight down. Let's see you. And press straight down. All right. So we're going to put you on top of the medical bed today. Go ahead and tippy toe. Press straight down. All right. So may I please ask you to back away just for a moment? And it's going to look like this. I'm going to put my shoulders on top. Press straight down. Lock those elbows. There we go. All right. And so how many compressions do we do per cycle? 30. Okay. And so what I will have you all do first is 30 compressions. Our feedback devices, which are required by the American Heart Association. When you press down deeply enough, you hear a click. When you press at the appropriate rate, you're going to see two green lights. If you see, and what happens is because this is kind of painful, you all will have this orange light flashing really fast. That means you're not allowing full chest recoil. You're going so fast because it hurts to keep doing this that you're not allowing the heart time to refill with blood. All right, so would you two please practice 30 compressions? Let's go. And count for me. 1, 2, a little bit too slow. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. All right, keep going. 1, 2, 3, 4, 5, 6, 7, 8. Great job. Count with them, teammates. Keep going. 1, 2, 3, 4. You have 3 more cycles. Great job. 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 20. Keep going. 1, 2, 3, 4, 5, 6, 7, 8.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24.
Help is coming. Don't get tired. Let's go. One more cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Great job. You all have 10 seconds to switch. All right, let's switch out. All right, next compressors. Let's go. Let's go.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Great job. Don't go too fast, Andrea. 21, 22, 23, 24, 25, 26, 27, 28. 4 more cycles. Let's go. 1, 2, 3, 4. Whatever number you all are on. Let's start together. Let's pause. Let's get our numbers together. All right. Woo! And if your bottom hand is hurting, I would recommend you have your lower fingers extended out. You can switch hands. That's the end of our 10 seconds. Let's compress some more. Let's go. 1, 2. Everybody stay together. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good job. 2 more cycles. You got this. 7, 28, 29, 30. 1, 2, 3, 4, 5. Lock those elbows. Press straight down.
8, 9, 10, 11, 12,
Watch me.
13, 14,
Move your hand. Get all the way over. All the way over.
15.
There we go.
16,
17, 18, 19, 20. You're almost done, Andrea. This is your last cycle. 26, 27, 28, 29, 30. Great job, everybody. All right. You're done. You're done.
Oh, I was like,
All right.
where are we going? I was like,
All right. So what we have guaranteed is that our instructors can actually compress on their mannequins. And so what happens, and I've seen this a lot, is that when nurses decide to retire, they're like, hey, I want to teach CPR. But if you can't do this, you can't teach CPR. And that means you also sometimes have to go to the ground with your students. But none of you all have to go to the ground because you all have actually compressed at the appropriate rate and depth on the actual simulated beds. And when you're with your team, of course, everybody will be on the floor,
Always on the floor.
always on the floor. What are the feedback devices required by the American Heart Association?
Rate, recoil,
Okay.
and I guess depth.
Depth. So the recoil, and that's when you'll get that orange light if you don't let the chest rebound, go back to its normal position. But it's going to be the depth, and you'll know you're going deep enough because you'll hear the click. And then for your rate control, you're going to have the lights in the shoulders. I recommend, and I'll send you all a link that has the equipment that you'll need. I recommend that you all purchase lots of rechargeable batteries. Don't even worry about traditional batteries. You want to be recharging these batteries. We just started labeling them. Like number 4 would always die. So we don't know what mannequin number 4 was doing in the middle of the night when we weren't here. But we charge those batteries, wake up the next day, and then it'd be dead again. All right. So now, if it's going to be team, so what happens is you actually do your assessment, and I'll do one right now. So we're going to look left and we're going to look right. We're going to make sure our scene is safe. Now, what do I do from there?
Check for response.
Hey, are you okay? Are you okay? And now, old school would be you'll check for the pulse and breathing simultaneously before you ever call for help. That's old school. When I am tapping and shouting at someone, hey, are you okay? And they're not responding, I need help right then. What would be a reason that someone is unresponsive but still alive? Overdose. And opioid crisis. What else? Hypoxia. She's using those.
Sorry.
Okay, so yeah, so any my baby over here. All right, she used the big terms, yes, but so they could have maybe they have low oxygen because they overdosed. What about a diabetic? Low blood glucose. So you don't need to crack their ribs. As soon as you tap and you shout, and that person's not responding to you, hey, you call 911 or come back. Or if you're in the hospital, you press your cold button. Now you're going to check for breathing and a pulse simultaneously. What is the name of the pulse that we check? Carotid. Okay, so usually we're not feeling for the radial pulse, the pulse that's in the wrist, and you're going to feel for the carotid pulse and check for breathing for less than 10 seconds. 9, 8, 7, 6. Person lets out a gasp, but there is no pulse and no other signs of life. We call that an agonal breath. An agonal breath is a precursor to death. You still start CPR. Okay. So 10 seconds, there's no pulse, there's no breathing. Hey, you call 911, bring me that AED. When your team comes, so you're going to do exactly what you did. You're going to do compression only CPR until your team arrives. For our demo right now, when your team arrives, they're going to come with the bag mask device. Andrea, let's let Andrea go first. All right. So, all right, I need everyone to practice. So, your airway person, think a respiratory therapist. And so, if you two would just watch them for now, it's going to be the EC clamp technique. And our mannequins have been difficult lately. EC clamp technique, open up the airway and give a breath. 1 and 2. And my recommendation would be that you squeeze the bag with your dominant hand and your mask would be on the non-dominant. All right, there we go. We got it. Good. All right. And so 1 and 2. Airway persons, stay there. Don't lose your hold. Compressors, get on that chest.
Should we demo it?
We've already done our assessment.
Okay.
I'm going to push this a little bit closer to you. Let's do 30 compressions and then pause. When you get to your 30th compression, you just simply raise your hands. We call that hovering. And that way your airway person can see if the breaths go through.
Mm-hmm.
All right, 30 to 2. Let's go. Count. Don't go too fast. 9, 10, 11, 12, 13, 14. Great job. And hover. 1 and 2. Great job. Great job. I'm going to pause you all. Now we can switch out. Okay. And so it's not, and right now, it's not about the 10 seconds because I need to make sure that you two ladies know how to use these bag mask devices. And so are you right-handed or left-handed?
Right.
Right-handed. I need the mask in your left hand and the bag in your right hand. All right. So here, hold on, babe. We got you. All right. So remember, this is not you rushing right now because we know that people haven't used this bag before. So this is going to be your EC. This is going to be here. Your hand's going to go on top. I'm going to actually move your body closer. And if you can have the patient's head rest against your left thigh, that's going to give you additional support. Lift the chin. Okay. And now give a breath. 1 and 2. Perfection. But if you feel like your hand's going to get tired, make a tighter seal. Okay. We got over here, Andrea. Thank you so much. And so, Andrea, if she can watch the chest rise.
Good job.
Good job.
You continue?
I'm waiting for, okay. So where do you feel air escaping? I recommend making a baby C. So baby, 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 baby. All right, good. 3 fingers, open up the airway. Use your left leg to balance. So use your left leg. All right, and now give that breath. And if you bring this bag up, typically you break your seal. And your hand's going to go right here. Give a breath. Where do you feel air escaping?
On the side.
Okay. There we go. We got to keep the airway open now. All right.
Yeah,
So,
that
all right,
sounds
keep the
good.
airway open.
Very
Keep the
nice.
airway open. 15, I'm sorry, 30 to 2. Let's go. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. All right, hover and 2 breaths. 1 and 2. All right, great job. And we're going to pause you all because this was just about you practicing with the equipment. And so, you two ladies, what is the hand placement called when you're using a bag mask device? What is this called? You're going to hear people say EC or CE, clamp technique. You can only utilize that technique when you're actually having the bag mask device. If you are managing the airway, where do you stand? Are you on the side? At the head, and that's going to become important because you can't be over here trying to manage the airway because you'll be blocking the compressor, blocking the person starting the IV. So if you're ever in the hospital sector and you see a code, you're always going to see respiratory therapists at the bed. And so when you're establishing your team roles, anytime somebody has this bag, they should be at the head of the victim. All right, if you two ladies will put the bags down. So everyone has practiced chest compressions. We've practiced with the back mask device. And now the next thing we're going to practice with is with the defibrillator. Okay. And I think for this one, you all can actually have a seat. Okay. All right, what does the AED stand for again? Okay. And when it arrives to the scene, what's the first thing you do? Turn it on. You want to power it on. Whenever you go to different corporations and teach, because a lot of us are doing this for entrepreneurial purposes in addition to helping save lives. But when you go to different corporations and teach, you want to, when you're doing your contracting, ask them to send you maybe the name and the make of their AED. So when you get there, you've already researched a video on it so you know how to utilize their AED. If not, because they said they didn't have one or whatever the case may be, when you get there and you ask questions such as, okay, tell me where your first aid kit is, tell me where your AED is. And if those two items are not together, that's something you want to make a recommendation for, because it doesn't make any sense to have one person running east and the other person running west. We need to get that one person to be able to bring the AED and the first aid kit back simultaneously, if possible. And then let's say they still didn't give you the information you asked for. When I'm there, when I'm doing my setup, usually I'm there earlier, I will go and look at their AED. And then I will incorporate whatever YouTube video corresponds with their AED, because I don't practice with live AEDs. I practice with our training devices. If you practice with theirs, it's live and it's only going to let you go so far because you didn't really undo their pads, because those pads are expensive. Any questions on how to conduct the corporate course and utilize the AEDs that are on site? You're going to have to incorporate some video so that those staff persons understand how to use the AED they have there. So for our training device, what's the first thing you say I do? And I'm not going to turn it on just yet because I don't want to talk over it. But once you power it on, the second prompt is going to be pad placement. And so during your classes, you can have 2 AEDs, but what I find that works is I actually allow the students to use their hands either on themselves or on their mannequins to show me the pad placement. And of course, we're opposite each other, but it'd be high right, low left with the chest exposed. When we say low left, a lot of people want to put the pad on the stomach, but the strongest part of the heart is right there at the crease of the breast. So that's where I want you to put that pad. On your own bodies, please show me the hand placement. Remember, we're opposite. High right, low left. Very good. Awesome. All right, so pretend I turned this on. It told me to apply the pads. I peel and I stick. I apply the pads. I peel and I stick. And then after that, this light's going to be flashing, telling me where I connected at. Can you use an AED on a pregnant mother? Sure, you can. When in doubt, if mom's heart has already stopped, what's happening to the placenta that's feeding the baby? No blood flow. But if you can get mom's heart re-going again, we have an opportunity to save mom and this baby. Regardless, I need you to do everything you can to save mom, because if we do get her to the hospital and she's, she has neurological deficits, we can still hopefully deliver the baby cesarean delivery, or if mom is brain dead, we can keep mom alive on life support and give the baby time to grow. But if you don't do anything, we're going to lose both of them. So turn it on, apply the pads, connect it. And right now I'm just talking you through it before we actually turn it on. It is going to say analyzing heart rhythm. Do not touch the patient. I want everyone to say clear.
Clear.
Clear. When you're teaching someone who's a layperson, someone who doesn't work as part of a team, they should not go back and touch this victim until it indicates that a shock is needed. Okay, it's going to, within a 5 to 10 seconds, it's going to say, hey, shock is required, charging. And then this light is going to flash. When that light flashes, you want to still make sure everyone's clear. If someone's touching when you press this button, what happens to them? It goes through them, they get shocked. So now you have to call another code team for them. So with basic life support courses, though, we're the advanced rescuers. We're good. So when this machine says charging, we go back and we do more compressions. And now before that person presses his button, they're going to say what? Clear. They're going to press that button. There is no residual charge. Immediately we go back and we do more compressions. The machine is going to start beeping. Beep, 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 beep. What is that beep called? Metronome. What is the purpose of the metronome?
Your compression pace.
Your compression pace. And so all AEDs that correspond with American Heart Association guidelines should have that tone. So if you're compressing too fast, I just need you to slow it down, compress with that same beat that you're going to hear. Now that we've talked about it, let's actually do it. Do you mind? Okay. And I'm just going to turn the mannequin around. And so you all are welcome to stay seated. You can see it from where you are. All right, so I only listen to you.
So let me know when
All right, so I'm gonna start doing compressions, and you just work around me or tell me to move whenever.
I'm gonna actually turn it on, right?
And you're gonna turn it on. Okay. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7.
Do not touch the patient.
And because we're training basic life support providers, when it says charging, you all say compress.
Shock advised. Charging.
Continue compression.
Stay clear of the
4,
patient.
5, 6, 7, 8, 9,
Deliver
10.
shock now. Press the orange button now. Shock delivered.
Continue compression.
Begin CPR.
Slow it down. Work with the metronome.
Very good. Give them applause, everybody. Very good. Thank you so much. I got it from here. I'm going to turn this off for classroom purposes only. And anytime you turn your AED off in your classrooms, I want you to say the same thing, because your students are going to do exactly what you do. They're going to mimic you because you're so smart. And I want to be just like Miriam. And I'm just going to turn my AED off. No, we turned it off for classroom purposes only. When would you turn off your AED?
When you get to the hospital.
So let's say you're in home care, let's say you're in a nursing home, when the paramedics come, that's when your AED gets turned off, when they put theirs on. The paramedics are going to keep their AED on all the way to the hospital. With Damar Hamlin, when he recently had his sudden cardiac arrest experience, I think they said they shocked him once in the van or something like that. And so it's possible for someone to regain a pulse. You just don't take off the AED because they regained their pulse, because they could lose their pulse again. So you always want to be in an ever-ready state until we can get them to the hospital to figure out what caused their arrest. This is going to reanalyze every 2 minutes. How frequently do you and your compressor switch places? Every 2 minutes. So every time it says reanalyzing, that should be your cue for your compressors to switch out. What questions do you have about the basic use of an AED?
I have a question about the placement of the left pad.
Mhm.
That's supposed to be below the breast.
Yes, it can, but as long as it's not hair there, it's not an imperfect placement. Because she watching you.
I have a quick question too. If
Yes.
you're where your student's in a complete panic and they put them opposite,
It
is that gonna
shouldn't.
affect the outcome?
No, but hopefully, because most of your defibrillators now are biphasic, and what that means is that a charge is dispatched through both pads. And so I want you to think of the pads as bread and the heart as meat. And your job is to try to sandwich that meat and deliver that shock. There are studies that have come out, which I've not seen it, where they're using 4 pads. And I'm thinking that's because they can use less energy. I probably do need to read up on it, but I promise I read a lot. And so could you imagine having someone who's getting, pretty much shocked all around the chest, but maybe because it's less energy, either way, it can sometimes singe the skin. It's not a good smell, and you can peel off some skin too. So using less energy is preferred. Advanced providers will use a manual defibrillator, and that's something they'll show you on the video, but they'll also say that this is not a part of your training. What questions do you all have about the AED use? How do you use an AED if you only have adult pads? How would you use them on a child or an infant? Say it again. Yeah, so they do have an attenuator, and that's just an adapter that you would connect the adult pads, I'm going to call it a connector into, and it will deliver less energy. But what about the pad placement? You have a pediatric victim and adult pads, front and back. The pads can never touch. Okay? So that's another reason why when you're at these companies, you want to see what their equipment looks like, what pads they have, because if they only have adults working there, they're not thinking about the pediatric visitor who would come, and you want to make sure that they know how to place those adult pads on that child victim. What do you do if someone drowned and you pull them out of a pool? Do you have to dry their entire body? No. If you stand in that pool of water, what's going to happen to you? So you're going to get a shock too. So you want to be mindful that water is a conductor of electricity. And even though you pull them out the pool and yes, their body has drained, you either step outside that puddle or you pull them down further so you don't worry, you don't want to risk getting shocked. Child CPR is very similar to adult CPR. For American Heart Association purposes, you can use the adult Manikins for child CPR. What age to stage constitutes a child? Age to a stage. Where does it start? 1 to puberty. 1 to puberty. And so I always give the same scenario. My son is 10. He is my height, like he sizes me up every day. And something happens to him and he has a SpongeBob t-shirt on. Is he a child or an adult? He is an adult. Okay, so these kids are big. So even when you say 8, I have to actually see if that child has reached puberty. If they have any breast development, you look at them and you're like, man, you almost bigger than my neighbor. You have to treat that child as if they are an adult. Your numbers don't change. How many inches? 2. How fast you compress per minute? With a child, you can use one hand, but you are going to become tired if you're doing compressions with one hand. And let's say that child doesn't survive. What's always going to be in the back of your mind? So I recommend that you always use 2 hands on the child, even though you can use one if you have the upper body strength. But if you cannot compress 2 inches with one hand, go ahead and use those 2 hands on the child. Once your team arrives, let me backtrack. If a child or an infant goes into cardiac arrest, more than likely it was not due to an electrical issue. What was the cause? So once you have a team that comes, we're not going to be providing 30 compressions and 2 breaths. We're going to do 15 to 2. Why?
Increase the amount of breaths per minute.
Yes, when you do the mouth, whenever you switch to 15 to 2, you end up giving double the number of breaths, and that's going to help that child survive. your video and your book will tell you that for a pediatric victim, child or infant, they don't have to be dead before you start CPR. It says they have to have a heart rate less than 60 with signs of poor perfusion. For an African American child, how would you know if they have signs of poor perfusion? Because we normally don't turn blue. Gums, mucosa, everybody, fingers, capillary refill. So that's pretty much universal. You're not sure, you can go for the capillary refill, just press and blanch. And if that fingernail was already peeled to begin with, and or if because if you think about when someone's dying and you hold their hand, how does their hand feel? Cold. So this child is struggling to breathe. They have poor perfusion. You have now on the phone. If you're in the hospital, we're calling the code. And those pediatric, the ICU, they're going to be there right there to assist you. But we may have to start CPR on a child victim, even though they still have a pulse. How are your are your pediatric heart rates faster or slower than adults? Faster. So if this child's heart rate is normally 140 because of his age, and now the heart rate's at 60, that means it's not any perfusion, no oxygen circulating. We can start our CPR. Infant CPR. So what I did, we covered adults. We talked about child. Now let's talk about infants. An infant is from birth to puberty. I'm sorry, birth to puberty, birth to 1. And we're almost done with our review so that you all can take your first test. Correction, poor baby. Thank you so much for. All right, so if you'll go back to your various teams. All right, and so for the infant Manikins, they actually have a button on their diaper, and that's how you would power them on to activate their feedback devices. Great job. And whoever's standing at the side of the victim, I just want you to practice a few compressions with 2 fingers. Go ahead and practice for me. All right. Great rate up front. Great rate, both of you all. Okay, and now I'm going to pause you. And when I pause you, what I want you to do is I want you to change your hand placement. I want you to do 2 thumb encircling hand technique. Great job. Thank you so much, Andrea. And so you're really going to wrap those hands all the way around. Let me come back there. You're perfect up front. Okay, so here we go. If you'll watch me. Wrap your hands all the way around. Yep. All right. And so when you're in this position, this is when your 2 fingers get tired and or when your team arrives. And so if your 2 fingers get tired, you can switch out hands or you can just utilize a different technique. The goal is to compress at least 1.5 inches. And if you have to stop to give breaths, we didn't cover mouth to mouth, but yes, you can provide mouth to mouth to a family member or a friend. On an adult or a child, you would squeeze the nostrils through a head tilt chin lift. But if you're providing mouth to mouth to an infant, it's not really mouth to mouth, it's mouth to nose and mouth. You put your mouth over their face, okay, and give a breath. If you all would switch out, let the next person practice chest compressions on the infant. 2 fingers first. Great job. All right, and so let's pretend you just got to 30. Do your 2 thumb encircling hand technique. Great job. And now let me incorporate the bag mask device, and you all can stop. And I always have this disclaimer, you all. When we purchase these Manikins, it's so hard to get the infant's chest to rise and fall. So if you get chest rise, I'm so proud of you. If you don't get chest rise, I understand because I can barely get it either. But what I do know is that if this was an infant in the real world and we're not getting chest rise with the back mask device, we're more than likely going to intubate this baby. So during our classes, if you do not see chest rise and fall, do not freak out because there would be another intervention that we do in the real world. Another thing is when you had the adult, you brought that airway, that head back a whole bunch. You don't do that with an infant. You don't need your leg or anything. It's just going to be a modified head tilt chin lift, and you give 2 breaths. So mask on, EC clamp technique, open up the airway a little bit and give a baby breath. 1 and 2, just half squeeze. Okay. Okay, so she got hers over there, but it's okay. It's okay. I'm gonna open up just a little bit. Go ahead and get your placement back. Open it up a little bit. Now try. You got it. Yay. All right, you all, hallelujah. The babies are cooperating. All right, and so now if you'll let your partner practice. You all have set the bar high. And so usually if you have this bag towards you, it's going to be a distraction. So the bag goes to the side and now open up the airway a little. Okay. All right. These babies are cooperating today. Great job. All right. So airway, keep stay. Oh, Lord Jesus, please let these babies keep working. All right. So airway, please stay where you are. Compressors, wrap your hands around. And it's going to be 15 compressions followed by 2 breaths. Let's go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
And then 2 breaths. Great job. And let's try it one more time.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great job. All right. And we're just going to pause. And then everybody, I still have one more question. You're welcome to have a seat. We just have to talk about choking. Great job, team. So we did adult, child, infant compressions. We know how to use the back mask device. We know how to perform the rescue breaths if we were going to utilize our mouth. If a adult is choking, we used to call it the Heimlich maneuver, but the Heimlich family sued, so now it's called the abdominal thrust. All right, and so if you're performing the abdominal thrust, would you show me on your own bodies how you perform it? Avoid the xiphoid process. Everybody avoid the xiphoid process. Good. And so what you want to do is when you take that knuckle, bring it down closer to their belly button. Imagine where their belly button is. And you're going to cup and you're going to do upward and inward thrust. Okay. And you do this until what happens? Until the object or they collapse. And this is important because when you take your test today, it's going to use a term like unresponsive choking victim, victim of a foreign body airway obstruction. Pretty much the person choked to death. The person has choked to death. They're not able to cough. Don't hit them in the back. If you hit them in the back, it just makes the object go further down. If they're communicating with you, encourage them to cough. If they can't communicate with you, they're making universal choking sign. You'll say, hey, are you choking? Can I help? Do the abdominal thrust. If the person's pregnant, you cannot compress on their belly. Would you show me how to do chest thrust? And again, avoid that xiphoid process. So center of the chest, and you want to go straight in. It's not like a sternal rub where you're going up and down. And you would do that until 1 or 2 things happen. What's the 2 things? Or it comes out. Okay. And you can also do that for somebody who's larger. And what I want to think about is, let's say you're in the nursing home and you're in the room by yourself with somebody and they start choking and you can't get around them because they're in a wheelchair. That's something you can also do to chest thrust if you can't get around their waist. For the babies. If you have a baby, you have a baby. Go ahead and take the baby. If you'll turn your chair so they're facing this way. All right. And whenever you're utilizing the back slaps, you're going to have the baby face down on your arm. Baby face down on your arm. The diaper should be lower. Excuse me, the head should be lower than the diaper. All right. So face down. All right. And we're going to do this. And I'm not suffocating the baby. My fingers are open, but what I'm doing is I'm actually supporting the head and the spine, okay? Because you know the babies have the larger heads. You're going to hit the back 5 times. Let's go. 1, 2, 3, 4, 5. Support the head and spine. Rotate to the opposite extremity. And now 5 chest thrusts. 1, 2, 3, 4, 5. Let's do it again. Let's repeat it. Let's go. Mama's not playing over there. Okay. All right, so, oh, you're good, Andrea. Your baby's coloration's improved and everything. All right. Would you all please pass your babies? Arm, and you utilize your leg too, but we start with the face down. And so your arm is going to be beneath and supporting. Head should be lower than the diaper. Head, so gravity can help you. So bring the head down. There we go. Let's do 5 back stops. Let's go. 1. Oh, you don't have to be that aggressive. Don't be like her. Just 5 and 5. And now support the baby's head and spine. Rotate to the opposite extremity. Now that baby almost bigger than you. So turn your chair.
Are you right-handed?
Yes.
Turn your chair. All right. And so I want you to practice holding the head with 2 hands. 2 hands on the head. Oh, no, no, no. No, no, no. No, no, no.
Okay, right, I'm in.
Okay, there we go. And now support and rotate. Opposite arm. Good. And now support and rotate. And rotate. Yes. And you can utilize your leg too. All right. So
Okay.
now we did back slaps, support and rotate. Let's do chest thrust. Utilize your leg. That baby's big. 1, 2, 3, 4, 5. One more time. Let's go. One more time. Let's go. Just 5 and 5. All right. So you two ladies, if you'll hold your baby upright, I want you to pretend that you see the object in the infant's mouth. Please show me how you retrieve the object. Which finger? She got 2 fingers over there. So try to use your smallest finger. Think of our different members, our team members' finger sizes. Try to use your smallest finger, and you want to do a little curve to try to get it out. That's your finger sweep. Can you do a blind finger sweep? No, only if you can see the object. Now, what do you do with the baby? Here's your baby.
Hey, thanks.
What do we do with the baby? The baby swallowed 2 things. We only got up 1. How will we know that? Take your baby to be seen. The baby now needs medical attention.
Right.
You were just hitting the baby in the back, holding the baby upside down. And now you're like, look, dude, I got up half the peanut. Go to sleep. No. The baby actually needs some medical attention, okay? So we have done a thorough review, adults, children, infants, CPR, AED use, and choking. Are there any questions that you have?
Are you just, on a side note, how often are you gonna check to see if it's come up?
There was a police officer, and this is probably about 3 years ago, and the mom was in the mall and the child was choking. And that police officer was just there. This baby still had some movement, some life to him. Probably about 3 minutes going back and forth, back and forth. And I don't know what indication. I mean, like maybe after a minute you can look, but if you don't see the object and the baby still has movement, you just keep on doing this because the baby's still alive. And after about 3 minutes, whatever was in their airway must have come out. The police officer holds the baby upright and gives the baby to mom. Here you go. I've done my job. Okay. And I'm sure paramedics and everything was en route, but just kept on doing it because the baby still has some tone, some movement. If that baby becomes limp, what do you do with the baby? Start CPR. So I'm sorry I can't give you a definite answer, but just keep doing it. Okay. All right. Any questions? All right. You all power off the babies. If the light's on, put the babies on the table. We're going to stop this video.